chronic diseases and cancer start years or decades before any kind of symptoms are observed. And there's an opportunity during those years and decades to actually reverse those diseases back. And I think that that was sort of like a crazy statement until a few years ago. But now there are actually clinical trials. There's lots of evidence to show that even something like prediabetes can be actually driven back to healthy. And prediabetes does not necessarily mean conversion to diabetes. So preventive medicine can occur years or decades before symptoms onset. That's important.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show, this is a mission, y'all. As healthcare leaders, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want to help you understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the flavor of the week about Amazon's new health AI agent for the One Medical app. How does this tool stack up against ChatGPT and Claude's latest healthcare tools? And what does it signal to us to have a third major consumer health AI announcement in the last 2 weeks? I'll talk about that. Then Dr. Momo Vuyisich, co-founder of Viome, shares how chronic disease and cancer start years before any symptoms emerge, how the concept of systems biology helps us understand prevention, and where precision health is making some pretty incredible new strides. I'm Jared Johnson. Let's get it. Flavor of the week. Did you really think Amazon was going to sit back and not come to the party? They sure didn't wait long to invite themselves after OpenAI and Anthropic debuted their new consumer health features. So last week, Amazon announced its agentic health AI assistant in the One Medical app. What does it do? According to their website, it can provide 24/7 health guidance and take actions to connect you to your provider, book appointments, read labs, and manage medications. That includes answering general and complex health questions by explaining your lab results, considering your unique health history, and explaining what this information means for you, providing guidance on symptoms, conditions, potential treatments, and wellness questions, helping you choose the right care option based on your specific situation, which could include a virtual visit, an in-person appointment, or urgent care, and it can help you streamline your ongoing care tasks, including helping you book appointments. How is it different than ChatGPT Health and Claude for healthcare? The way they put it, unlike generic health information tools, Health AI understands your medical context without requiring you to manually upload your personal information from multiple healthcare providers and services. Is it safe? According to CNBC, Amazon said that Health AI isn't intended to provide diagnosis or treatment, and it shouldn't replace a doctor's visit. The tool is programmed with clinical protocols that identify when symptoms or conditions require escalation to a provider or for an in-person visit. All right, what's the consumer lens here? Remember, the staying power of these new tools is completely based on adoption, and adoption is completely based on how much consumers trust them. That's what so many of us working in healthcare can easily forget. And what's that trust based on? It's pretty simple. Does the tool work? And to know that truly, we need to actually hear from people who don't work in healthcare. We need to hear from consumers themselves, not from more insiders telling us who's going to win or lose. So best case, we're witnessing consumer health transformation in real time with the availability of these tools that can finally make good on technology's decades-long promise to simplify and personalize healthcare encounters. Worst case, we're just spinning our wheels and making those poor digital experiences of the past hurt even more. Now, this does feel different, and I'm bullish as usual, though I wouldn't put Amazon's announcement in the same tier as ChatGPT and Claude's simply because of lower reach, being only available to One Medical members. Either way, I'm already starting to get the feeling that the real race for consumers' trust in healthcare is just beginning. Let's move as quickly as possible to learn the true potential of Amazon's Health AI assistant and other new tools so we can play our part in growing adoption. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week. Hey, I'm here with my friend Carol Flagg from Healthcare Now Radio. Carol, you and I have an exciting new partnership that we want to tell people about.
Yep, we'll actually be launching an exclusive new opportunity called Limited Series. And these series will air nationally on Healthcare Now Radio, which, by the way, was named once again as one of the top 10 healthcare shows again in 2025, as well as here on the Healthcare Now Wrap. These series are going to cover some of the biggest topics in 2026, starting with rural health and including the CMS health tech ecosystem, GLP-1s, wearables, and more. So we're really excited about these series because there's a lot to talk about with these topics, which means they are ideal opportunities to create thought leaders in these spaces.
Yeah, Carol, that's what I'm the most excited about, is to really generate more informed, trusted information on these topics. And for those who are interested, spots are extremely limited for Q2 through Q4 of 2026. To get started, just reach out to either of us on LinkedIn, and we look forward to hearing from you. Hey y'all, I'm here with Israel Crush, founder of Hyro. Israel, what's an easy to understand example of how an AI agent can help consumers in their health journeys?
A simple section would be the fact that instead of enrolling into Medicaid and proving that you're eligible once a year, you need to do it once every 6 months. Patients don't know that. So we said, you know what, we're going to get ahead of that and we're going to educate patients about some of those changes and try to get them re-enrolled or redetermine their enrollment into those programs to make sure that one, they're covered, and two, that the health system gets paid or reimbursed for those patients. So I think that's like a clear win-win where you create an AI agent that is proactively helping both patients and health systems with issues that they face and make, again, the journey a little less complicated.
Thanks, Israel. Visit hyro.ai for more information. That's HYRO.ai. And tell them you heard about it on Healthcare Wrap. All right, let's get into the flow, everybody. I'm here with Dr. Momo Vuyisich. Momo is the Chief Science Officer and co-founder of Viome. Hey, welcome to the Healthcare Wrap.
Glad to be here.
I agree with you. I think we were saying off camera that we could have a 3-hour conversation easily about everything that's going on here. Let's centralize ourselves on a couple of points, because I definitely want to talk about, a little bit of the science behind Viome and kind of what the latest and greatest is, but also how it intersects with healthcare encounters. One of our goals clearly on this show is to connect what we do when we are meeting with, speaking with, visiting with a healthcare professional. That's a journey. Then wellness and prevention tend to be a different journey, and I don't think they have to be. I think they can be very related. So we'll definitely want to dive into that and just hear a couple of other observations you have going on. But let's give you a chance first, though, to introduce yourself. What would you like our listeners to know about who you are and what you do?
I'm a scientist and entrepreneur. I worked in academia for about a decade, in the government for about a decade, and now in a private company for about a decade. So I have quite a bit of scientific experience. And my mission is really to bring true preventive medicine to the masses, because I think prevention is far better than treatment. And knowing what the future holds instead of waiting for some bad luck to occur is really now within the scope of today's science and technology.
It really is. It really is. Your role right now, Chief Science Officer, where are the main things maybe day to day that you're actively involved in these days?
In a startup like ours, there's just so many things. I'm the head of clinical research. So we have a very active clinical research program. We have recruited over 16,000 clinical research participants over the last 8 years. And so we've spent tens of millions of dollars on clinical research, and I can touch upon some of those, but our publications are listed on viome.com/publications. And then I obviously spend a lot of time developing new products and improving the current products in terms of science, and then any kind of internal or external conversations that include science I'm involved in. So lots going on. But if I may, I'd like to start with sort of some takeaways from this conversation, sort of like a high-level summary. So some takeaways that I'd like people to definitely remember are that chronic diseases and cancer start years or decades before any kind of symptoms are observed. And there's an opportunity during those years and decades to actually reverse those diseases back. And I think that was sort of like a crazy statement treatment until a few years ago. But now there are actually clinical trials. There's lots of evidence to show that even something like prediabetes can be actually driven back to healthy. And prediabetes does not necessarily mean conversion to diabetes. And that's just one of many examples. So preventive medicine can occur years or decades before symptoms onset. That's important. The next takeaway that I think is super important is that genetics does not determine your health status. It is a factor, and it is a tiny factor in some diseases. It is a larger factor in some other diseases. So there's a different influence of genetics on different diseases. But in almost all cases, it is a small fraction, which means that nutrition and lifestyle are the major factors that influence whether you're going to get sick or not. So that's really a major takeaway. Do not let someone tell you, hey, diabetes is genetic. There's nothing you can do with nutrition and lifestyle. Take the pills and hope for the best. That is not an acceptable statement. Last but not least, I want to point out that the human body is very complex, and any disease onset is going to be due to many factors. So Alzheimer's, Parkinson's, multiple sclerosis, diabetes, all of those, fatty liver disease, any disease basically, and any cancer are the result of many interactions between us and the environment. And those interactions are heavily biased towards nutrition and lifestyle, like exercise, sleep, stress, but they also have to do with our exposure to pesticides and heavy metals and mycotoxins or mold. They also have some other factors, but one of the major factors is the gut microbiome and the oral microbiome. And I'll just highlight a couple of things here because we don't have too much time, the importance of these. And so oral microbiome, for example, I'll highlight a good and a bad function. Oral microbiome plays a central role in regulating our blood pressure as we get older. So as we get older, our own human genes are incapable of regulating our blood pressure. We rely on the oral microbiome, the salivary microbiome, to create chemical signals that lower our blood pressure. And that has to do with how many nitrates we consume in vegetables, and then having a healthy microbiome to process, oral microbiome to process those into nitrites, and then that lowers our blood pressure. So that's a positive thing. A negative thing would be there are many bacteria in the oral cavity that can turn pathogenic. So these are normal friends, but they can turn pathogenic. So that's oral microbiome. On the gut microbiome side, out of hundreds of examples, I'm just going to give one positive and one negative. We all know that there are people who get sick repeatedly and who do not respond to vaccines. And we know of people who get sick once with COVID and never get it again, or they get vaccinated and they don't get the disease. So we now, scientists, have figured out exactly the mechanism of this. The mechanism of immune memory, meaning we remember, our immune system remembers previous infections and protects us against future infections, depends on a molecule that must be produced in the colon by our gut microbiome, and that's called butyrate. That molecule signals our immune system to create a memory. And without that molecule, we lose the memory and we get sick repeatedly, or the vaccines don't work. So that's one really healthy example. A bad example is, for example, where we have the gut microbiome releasing molecules called lipopolysaccharides. And these lipopolysaccharides are basically messaging our immune system that we might be infected. And the immune system mounts an immune response against nothing and basically causes systemic chronic inflammation that is basically the root cause of many chronic diseases. So these are just tiny little vignettes of the importance that microbiome, both oral and gut microbiome, play in our health and how nutrition regulates both of those. And so that all ties in together. So the concept I would like everyone to take away is the term systems biology, that if someone has anxiety, that's a systems biology problem. It's not a brain problem. If someone has bipolar disorder, that's a systems biology problem. If someone has pancreatic cancer, that's a systems biology problem. So we need to think of the human body as a whole, multiple organ systems, and take into account the oral and gut microbiome into that process.
I think as a society, I kind of look at this at a large scale and think, while we might talk a lot about on the show about individual consumers making a health behavior or decision on any given day, that's what this all adds up to, is a societal impact, for better or worse, as we understand how our bodies actually work. I mean, when you're talking about about genetics, when you're talking about prevention, when you're talking about the gut biome or the oral microbiome, we're talking about things that thankfully I hear a lot more about than I did even a few years ago, even a couple of years ago. And I think that's a positive trend for us. I'd love to hear how Viome fits into that. What are some of the things in particular that are either just getting more traction or more momentum in this space as you do see more people start to understand what they need to do?
This journey started in 2010 when I was a government scientist, and I, through many factors that we don't have time to discuss, I decided to reset my scientific career and devote the rest of my career to the systems biology approach to preventive medicine. And so 15 years later, where we are today is our customers collect stool, blood, and saliva samples at home. So even blood is collected at home. It's a very simple finger prick blood sample. These samples are shipped to our lab here where I work in Seattle at room temperature. So there's no fridge, refrigeration, or freezing or anything like that, just snail mail. And we have a technology that's very unique to Viome that no entity in the world has. It's a metatranscriptomic technology, or RNA sequencing. So we analyze the microbiome and human blood in a way that no other company does. But we do that because RNA sequencing and RNA molecules in general are very relevant to human health. They're far more relevant than DNA, which most tests focus on. And so when we talk about DNA, the DNA you're born with is the DNA you die with, and the DNA that's going to be there in your grave 12,000 years later. And so the DNA at birth just says you have a higher risk of developing, let's say, IBD. It doesn't tell you anything else what to do about it or whether you're actually going to develop IBD. So that's all that a DNA test tells you. What an RNA test tells you is today you have no risk of IBD. We've measured more than 10,000 biomarkers in your stool, blood, and saliva, and you have no biomarkers that are going to lead to IBD, so you have no risk, and we're going to display that in the physician report. Or out of the hundreds of biomarkers that need to be out of balance in order for IBD symptoms to occur, here are the 30 that are out of balance in your body, meaning you have a low risk, but you are kind of on the way. Or here are the 150 that you have out of balance, which is why the computer says you have a moderate risk, or maybe even more for a high risk. So our physician report, after we do the lab analysis, will list for currently 20 diseases, but that number is growing. It will list the disease risk level from no disease risk to low, moderate, and high. And what does that mean? None of those 4 risks are a disease diagnosis. You don't have the symptoms yet, or you may have some mild symptoms in the highest disease risk category. But what the data are saying is we've measured your biology, we've identified all pieces of your physiology that are broken that can lead to IBD. And the more of those that are broken, the closer you are to the actual symptoms. And so if you have mild risk of disease and we tell you should stop eating certain foods, you may say, that's not worth it for me. It's still a mild disease risk. I'm not too worried about it. I'm going to continue eating those foods. But next year you test, and now we say, more things have broken, and you have now a moderate disease risk. You might now pay attention and say, wait a minute, I better do this, right? And so basically we provide a very objective insight into your physiology, and you get to decide as a physician and a consumer what actions you want to take. All actions are already recommended in the app, meaning here are the pieces that are broken, and here's how to fix them. It's your choice whether you want to fix them or not.
Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap. When does somebody typically engage with Viome and kind of get the most benefit out of it? Like, how does that complement the care they might receive from a clinician or somewhere else?
Our vision is for people to engage with Viome at birth. Right after birth, one of the most significant events in life happens, which is acquisition of a microbiome capable of creating a healthy environment for proper healthy development of the human body. And again, this is like an hour-long story, but in summary, there are very important species of bacteria that need to colonize the infant's gut in order to create an environment that protects them against pathogens and that produces molecules that stimulate the development of physical health, mental health, cognitive health, and immune health, all of those. And so starting at birth, you should be analyzing and digitizing your body using the Viome approach all the way until death. So there are very important events that happen early in life. And then as you grow older, even people in their 20s are not healthy. They have some parts of their physiology that are out of balance. And you may be one of those people that says, I don't care, it's fine, I'll wait another decade. But you may say, you know what, let me fix those before more things break. Let's just keep everything in balance. Basically, our tests empower everyone to identify all parts of their physiology and understand which parts are out of balance and which parts are not, and then to fix those that are out of balance at their leisure. That's basically what the technology brings.
Well, I like this holistic approach. I mean, it's what we need to have the right answers and the right understanding of the behaviors that we need to take. What have you observed about how consumers approach their health today and how that's changed in the last 12 to 24 months? I just feel like there's so much happening. There's such an evolution of how people understand their options. And when they do come across a solution like Viome, that they understand how it's even useful for them, I guess.
We've seen obviously dramatic changes in the last few years. In 2010, when I even mentioned something like, hey, gut microbiome plays an important role in human health, even scientists and physicians said, that's just false statement. Like we don't understand. We don't know that, right? But today you can have a meaningful conversation with a Uber driver about your microbiome. So the world has changed a lot. And the parts that I'm particularly excited about are that today's patients, whether they have a disease or not, they are now demanding nutritional advice from their healthcare providers. And that's a really dramatic change that I like to see, because what I'd like to see is the entire healthcare system integrating Viome, systems biology approach, and personalized nutrition to every patient, independent of what the reason is for that patient to be at the healthcare setting. So if someone is a 40-year-old marathon runner who just wants to do a yearly checkup, or if someone has an advanced disease, it doesn't matter. I would say that our vision is for every single interaction between a patient and a healthcare provider is let's start first by profiling you with the Viome Precision Health Pro test. Let's understand your biology. Let's understand every single detail of what is in balance and what is out of balance. Let's discuss what's out of balance, how it combines with your other risk factors, with your other behaviors, with your potential medication symptoms. And then let's have this holistic approach to your both preventive medicine and maybe care, right? And so that's really the exciting part. And we now have an active program where physicians can sign up. The website is called viomepro.com, and physicians can sign up, and then they can order this professional or provider test for their patients. And we will actually deliver the report to the physician, to the provider, so that they can discuss the results with the patient. And the results include not just the basics of what microbial members are there, like what species are present in saliva and stool, but very much molecular scores, meaning what are the parts of the physiology that we measure, and are they in balance or out of balance? And then we will show the risk stratification for currently 20 diseases that can be discussed. And for every disease, we show exactly what is out of balance. It's not just a score that says you have a moderate disease risk for IBD. No, it will say, here's why it's moderate, because all of these parts of your physiology are broken. And then from the parts that are broken, it'll immediately show you what are the actions immediately that you can implement in your life in order to reverse those back to health?
So you just mentioned a test. Was it called Precision Health Pro? Can you tell us about that? Like, where does that fit into what you just described?
Our flagship test for consumers is called Full Body Intelligence, and that can be ordered by anyone on our website, viome.com, right? And that's been a test for several years. But now we have this provider version, and it's called Precision Health Pro. It is not available direct to consumer, so a provider has to register on viomepro.com. And once they register, they can order these tests for their patients. And the test is more robust than the direct-to-consumer test. And it has this disease risk stratification. So it shows for that patient exactly what risks are they at the current moment based on their current physiology. This is not based on DNA and their risk at birth. This is their current status measured by RNA technology that we have here at Viome. And then it provides very direct recommendations, nutritional recommendations for that person in order to fix all of those imbalances. And all that information is provided to the provider, and then they can have a meaningful conversation as to how to integrate nutrition into their care. And like I said, the care can be, hey, you're doing your yearly checkup, you're healthy, you have no symptoms, but hey, here are the parts of the physiology that Viome measured as broken, you should work on those. Or maybe that's a person who has some kind of a disease, whether it's a fatty liver disease or it doesn't matter. The doctor and the patient can choose to integrate a good nutritional advice that's based on that person's data, and then see the progress by retesting every 6 months.
How do people find out about it? Like, how do we as an industry grow adoption for services like this? I just feel like there's nothing but upside for clinically validated services like this, for diagnostic services that actually work and capture the right things and are able to connect it in this way. Like, yeah, how do we do that?
It's grassroots efforts like this one, like this podcast and many others, like many other interactions that we create. But really, the pressure is going to come from the consumer. The consumers are now becoming more educated. They're going to be demanding basically integration of nutrition into their healthcare. And so I think that's going to be the pressure, but there's also a lot of concierge clinics and a lot of even doctors from the traditional healthcare settings that are saying, you know what, I need to incorporate nutritional advice, but I don't know what eating healthy means. And so then they find Viome and they're like, wow, you don't have to now make these sort of generic statements, eat fiber, eat more fruits and vegetables. There's now a way to measure more than 10,000 physiological biomarkers in the human body using our test. And every single one of those 10,000 biomarkers is actionable, meaning the computer converts it into a specific set of recommendations. Now, let's spend a little bit of time, because I'm the head of clinical research and I want to make sure that people understand that these recommendations are backed by tens of millions of dollars worth of research that has been published. And so I'll just highlight two of those research papers. So in one research study, we did a study on 550 people in the US and 550 people in Japan as sort of the most different sort of culture, cuisine, genetics, and so on. And so we did a study with 1,100 people. They wore continuous glucose monitors for 14 days. And so 1,100 people times 14 days consumed 60,000 meals. And we obtained accurate measure of their glucose response to those 60,000 meals. And prior to this, we collected their stool sample. And then we challenged AI and said, based on that stool test that we did just prior to this experiment, could you actually have predicted the glucose response to each meal? And the computers came back and said, yes, we could. And so we developed a postprandial glucose response model. And that just basically means that based on our stool test, we can actually tell you how high your blood sugar will go when you eat potatoes and rice and beans and every single type of food, so that you don't have to guess how you can minimize your blood sugar levels. And we've incorporated this into our app. Every customer benefits independent of what test they do. And we've shown in single arm studies that we published that this approach actually reduces type 2 diabetes risk. And then we now published a preprint of a randomized blinded placebo-controlled trial showing that this approach lowers HbA1c, which is the main biomarker of diabetes, more than placebo, very significantly, statistically and clinically. That sort of process has taken 8 years and tens of millions of dollars, or multiple millions of dollars just for that one project. And then I'll state one more, which we just published a paper 2 weeks ago. We took 10,000 humans who either had IBD or didn't have IBD, and they had either ulcerative colitis or Crohn's disease, and they were either in a flare or in remission. We also took healthy people to match them by many different criteria. And we developed a machine learned model. So this is AI analyzing the data and telling us, okay, here are the parts of physiology that are very important for IBD. And then what is really robust about this study is then we gave the computers 70,000 people blinded in a blinded fashion and asked the computers, okay, just based on the data, we're not going to tell you anything about these people, just based on the molecular data for these 70,000 people, tell me what are the odds that these people have either ulcerative colitis or Crohn's disease and that they're in remission or they're in a flare. And the computers did a fantastic job. They predicted really well, which means that the model works. What they learned works. And so we just published that 2 weeks ago in BMC Gastroenterology. It's a premier journal in this space. So these are the kinds of very large, very expensive, very involved studies where we're analyzing samples from 80,000 people and doing machine learning and using supercomputers to learn about how the human body works and then converting those into very specific recommendations, which we don't have time to discuss, but those have been published. We did publish a paper in American Journal of Lifestyle Medicine that describes how we convert molecular data into nutritional recommendations.
Thanks for sharing that, because this is the piece that we need just infinitely more of. We need the clinically backed studies, we need the research, we need the papers, we need that to just drive things forward so that we truly can bridge this gap from the clinical world to the wellness world. The data is there, and that's fantastic to hear.
The math is all shown, the p-values are all shown, so it's very robust because it uses data that are relevant to human health, which is why we're measuring RNA, not DNA. And second, we do it on a very large population, so the statistics is very solid.
More of that, please. As I'm looking at some of these they probably feel like basics from this standpoint, and yet they're important pieces of the puzzle as we look at how our health and wellness products and services, how are they designed, how are they marketed, how are they delivered? It's all important. It's all part of what we're talking about here. To that end, I wonder what else we haven't talked about yet. What else would you hope that everyone would understand about this space, either about their own health or about the solutions that Viome is offering, about diagnostics in general? Just what else would you wish everyone would just kind of understand at a basic level?
One of the most important takeaways is that our nutritional lifestyle must be personalized. Yes, there are some general and generic pieces of advice, but if you are told by someone you need to eat healthy, you are going to be confused because what is healthy? You're going to go say and ask yourself, okay, should I eat dairy? Well, you go find papers that say dairy is good for you, and you go find papers that say dairy is bad for you. And you can do the same thing for eggs and red meat and any other thing, right? And so to me, the biggest problem with all of the past nutritional science has been this lack of personalization, meaning that studies have been set up to ask the question, is coffee good for all humans or is it bad for all humans? And depending on how the study is set up, the conclusion of one study is that it's good for humans and the conclusion from another study is that it's bad for humans, right? It turns out that coffee is bad for 54% of the people and good for 46% of the people. And there's only one way to find out which category you're in, and that is to do the Viome test. There is no other way to guess because, well, it would be guessing. And the same thing is for broccoli. The same thing is for spinach. The same thing is for red meat, eggs, egg yolks versus egg whites. The same thing is for chicken versus not. All of these, there is a certain percentage of people that are going to benefit from that nutrient overall. And there are people who are going to have a detriment from that nutrient overall. And it depends on the person. So there is no possible way for anyone to say, well, I'm just going to guess and do well, because that's going to be based on some conflicting studies. So we need to personalize nutrition, and Viome is bringing that science to everyone today.
Well, thank you for that. Great example, too, of just what this means on a day-to-day basis for somebody, because that type of thing, I experienced it myself. That really hit home of the fact of you can find stuff that says something's good for you or it's not so good for you, and just taking that at face value without anything personalized. At least for me, it doesn't get me any further closer to health than it was before I started researching it. So
it was that simple.
Yeah.
If there was a universally healthy diet, believe me, we would have figured it out. That problem would have been solved. But unfortunately, it doesn't exist, which is why there isn't, we haven't found one.
Momo, it's been such a pleasure to have you on. I just want to thank you for joining us today, for everything you're doing to truly make healthcare more consumer-centered. Looking forward to hearing where things go from here, to watching the momentum continue, and watching us get to a better state of health as a result. That's where my hope is with all of this. So thank you for joining us today.
My pleasure.